Good morning, everyone. So today I'm going to talk about multimodal management of knee and shoulder pain, focusing on muscles. So if you look at the statistics, 2019 statistics say that global age standardized prevalence rate of all the osteoarthritis was quite high as compared to last 10 years, and the incidence was quite high in Europe and America as compared to Asia and Africa. Radiographic knee osteoarthritis form very small group of those who have knee pain. Now, what are those other patients who have knee pain? There could be other pain generators like muscles and tendons, ligaments, bones, menisci, bursae, and nerves around the knee joint. But muscles and tendons form very important role in causing knee pain. Why so? Because whether the pain generator is ligament, bone, menisci, or bursae, everything expresses itself through muscles. Now, why there should be so much of involvement of muscles? Because there is agonist-antagonist interaction. So there has to be proper balance between agonist and antagonist. If this balance is impaired, then there would be pain. So say for example, hamstrings are tight, it will reflexly inhibit quadriceps and there would be generation of lot of trigger points, and that will lead to pain. And same is true vice versa. So this is how the upper part is normal muscle. Normal muscle extends between the two bones, there is attachment of tendons. But if trigger points develop in muscles, that will cause shortening of the muscle, and tendons being less elastic than muscles, there will be a lot of pull on the tendons that will lead to inflammation and effusion around the joints. So this is responsible for boggy swelling, which is being seen in osteoarthritis and rheumatoid arthritis. So these findings are seen on USG also. Here you can see the dumbbell shaped hypoechoic structure between the two muscle layers in case of osteoarthritis. So why should there be involvement of the muscles in cases of osteoarthritis? It's because of the Hilton's law. So what Hilton's law says is all of the motor efferent which serve the muscle also carry the afferent branches from the capsular elements. So whenever there is involvement of the joint, the muscles are ought to get affected. There has been role of central sensitivity in pathogenesis of osteoarthritis of knee, which is being proposed. So with this, because of the sensitivity, neuropathy happens, and this neuropathy does not have any predilection for sensory nerves. It equally involves sensory as well as motor nerves. Now this motor neuropathy will lead to development of myofascial trigger points, and because of this myofascial trigger points, there will be a lot of pain and stiffness. This will reduce range of motion, and whenever patient tries to again do some movement, there will be further increase in inflammation and pain. So with our treatments, what we do is pulse radio frequency. Pulse radio frequency will reduce the neural traffic. There would be reduction in spontaneous pain. There will be reduction in rest pain, but movement related pain still continues. So we do ultrasound guided dry needling to reduce pain, stiffness, and increase the range of motion at the joints. So Ashirvad is the name of our clinic. Here we do, if patient has NRS of more than 5 to 7 on 10 and there is positive response to pregabalin, we do pulse radio frequency of the nerves which supply the muscles which cross the joints, and it is followed by ultrasound guided dry needling sessions. This pulse radio frequency is done for 42 degrees Celsius for 8 minutes at each site. If NRS is less than 5, then we do only ultrasound guided dry needling sessions. These sessions are done twice a week for first 4 weeks, once a week for next 4 weeks, and follow-up sessions are done every month for 2 months. So for knee osteoarthritis, we target the muscles quadriceps femoris, sartorius, and adductors. Posteriorly, we target hamstrings and gastrocoliae. So you can see the constant twitching of the muscles whenever we are trying to put the needle in the quadriceps femoris for giving trigger point injections. So all these pains are visible on ultrasound. Here we are doing pulse radio frequency of the femoral nerve. This is the ultrasound picture. Here we are doing pulse radio frequency of peroneal nerve. The other nerves which are targeted are tibial nerve. We target peripatellar plexus. The needles are put in this direction subcutaneously, and for the subsartorial plexus under ultrasound guidance, we locate sartorius, and just below the sartorius, above knee, we put the pulse radio frequency needle. So, few cases. This is 55-year-old lady who had rheumatoid arthritis with multiple joint involvement. You can see she has to literally drag her feet to walk. But after pulse radio frequency and ultrasound guided dry needling session, she is walking independently, pain-free. This is 60-year-old lady who had grade 3 osteoarthritis, not willing for surgery. So we decided to go for pulse radio frequency and ultrasound guided dry needling sessions. So this is her video after 2 years of treatment, and she is absolutely pain-free. He is 80-year-old gentleman who had to be who had grade 4 osteoarthritis. He was to be carried by 3 people to our clinic. Again, he was not fit for surgery, not willing for surgery. We did pulse radio frequency and ultrasound guided dry needling sessions, and he is walking pain-free without any support. For shoulder cases, we do ultrasound guided dry needling of the muscles which are attached to scapula and shoulder muscles. We do pulse radio frequency of suprascapular nerves, axillary nerve, radial nerve, musculocutaneous nerve, spinal accessory nerve, and subscapular nerve. We don't do pulse radio frequency of only genicular nerve, but we do pulse radio frequency of the nerves which supply muscles crossing the joint. Okay. So this is the same lady who had shoulder issues also. You can see she is not able to abduct her arm beyond 20 to 30 degrees, but immediately post pulse radio frequency she is able to go beyond 90 degrees. She is a 62-year-old lady who has been suffering from frozen shoulder since last 1.5 years, but after pulse radio frequency and ultrasound guided dry needling sessions, she is able to regain all her activities, and she is able to achieve all the movements at shoulder joint without any compensatory action at the shoulder, at the trunk. This lady had restricted internal rotation and stiffness, but within 2 sessions she has recovered. This gentleman had a lot of shoulder stiffness following pacemaker insertion. You can see there is restricted external rotation, there is restriction of the abduction, but after few sessions of dry needling, he has regained all the activities at all the movements at shoulder. This young boy had restricted range of motion at shoulder joint following shoulder hand syndrome. Before treatment, he was not able to go beyond 90 degrees. You can see wincing on his face, but within 6 sessions he has regained full range of motion. So these treatments are safe, effective and minimally invasive. They address motor, sensory and autonomic components, and they provide sustained relief from pain, stiffness and swelling. Thank you for patiently